New at 6, what most parents and caregivers want most for their children is health and happiness. So any sudden change in their behavior or well-being can raise alarm bells. In this month's Vegas Stronger Champion, we introduce you to a local pediatrician who wants to raise awareness about a rare pediatric disease after his own son was diagnosed with it. Throughout his 16 years, Dr. Henry Key's son Matthew has had his fair share of health issues. He is cognitively delayed and has a rare form of epilepsy. But in early June, Dr. Key says it was like a switch flipped and his sweet, witty boy was gone.
I lost my son. So it's like somebody else took over him.
Overnight, Matthew started showing several concerning symptoms: uncontrolled laughter, obsessive thought, a Tourette's-like motor tic in his mouth, anxiety, nightmares, oppositional behavior, and physical shaking.
Within a few weeks, he would stop talking to us. He would start talking to the ceiling. He said that there's a voice in his head that the dream can take over the reality, basically.
Dr. Key and his wife initially thought that Matthew may have some kind of mental illness, but he says he didn't believe that psychiatric disorders came on suddenly. They spoke to several specialists, and about a month later, Matthew was admitted to the hospital and treated for encephalitis. But the treatment only made him worse.
When we get home, we hit the low point. That's when he ceased talking to us. He talked to the ceiling. He was as catatonic almost.
Dr. Key was desperate. He went back to Matthew's pediatrician, who recommended a pediatric rheumatologist who had once treated a patient with a rare disease called pediatric acute onset neuropsychiatric syndrome, or PANS.
He's fit like a glove.
Matthew was taken to Summerlin Hospital for 2 days worth of IVIG.
7 days after the treatment, he showed sign of improvement.
Dr. Key says Matthew began talking to his family again. He was sleeping and eating better too. 3 weeks later, though, his symptoms came back. Dr. Key says for severe cases like Matthew's, patients may need monthly IVIG treatments for 6 months or longer. But Matthew's getting better, and with every treatment, returning to himself.
I never cried so much in my life, honestly. Usually I'm trying to be pretty tough, but for us, July, he got better, the last month or so. I was so thankful, the last 2 months, but it was very heartbreaking.
It would certainly be heartbreaking for anyone. Now, Dr. Key believes that PANS may be under-recognized, and if you recognize any of these symptoms in your child, Dr. Key recommends finding a good rheumatologist or immunologist and a psychiatrist to address those behaviors. Now, Vegas Stronger Champion is sponsored by Findlay Automotive.